Steve, this is a bleak milestone that we've hit just 4 months after the virus first made itself known in China.
Yeah, that's right. I mean, it's such a quick spreading of this coronavirus. And we're seeing now, of course, the United States continues to be the biggest source of infection, the epicenter, if you will. Nearly 1 in 4, 23.6% of all those million-plus cases are in the United States. 1,011,490 worldwide. U.S. has 238,820. That is nearly 3 times China's reported numbers, and as I said, nearly a quarter of all the world's cases. The numbers are grim, Heidi. Italy, 115,000 cases now. Spain, 112,000. Germany, 84,000 and counting. All 4 of those countries have more cases than what China has reported at 82,000. Even New York State has more cases than China has reported, 92,381 in New York, and 9,000 new infections reported in the state of New York in the last 24 hours. And at this current rate, the state says it has about 6 days left before running out of its stockpile of ventilators. About 350 patients per night need ventilation, and the state says it has about 2,200 ventilators stockpiled. So that is becoming a very critical time frame, 6 days. And speaking of which, Donald Trump, the president, has issued an order using that Korean War era Defense Act, the Defense Production Act, to speed up production across the country of ventilators. He has been facing mounting pressure from governors and congressional Democrats to use that act to get the states and hospitals much-needed supplies.
Stephen, we're also hearing about more restrictions in Hong Kong. What do we know?
Yeah, that's right. I mean, Hong Kong has seen a surge of secondary wave infections, now up to 802, another 37 new cases in the last 24 hours. 30 of those 37 had overseas travel. So the government, late last night, has now ordered bars and pubs to close completely for 14 days, starting tonight at 6 p.m. And the Food and Health Secretary here, Sophia Chan, says more than half of the 132 locally transmitted cases between March 19th and April 1st had visited bars recently, and she called those establishments very high risk, including one of the new infections was a 6-week-old baby whose parents had taken them to a pub. So that was an impetus for the government closing down those establishments. I might add as well, one of the new indications out of China, nearly 4 out of 5 people recently tested in China had no signs of infections. This being reported by the BMJ Journal, citing China's National Health Commission. And that really stokes concern that the number of silent carriers may be greater than previously thought.